Hello everyone, my name is Monica Watson, and today's presentation will be about moral right to healthcare. The topics of this presentation will be stock law, cultural competence, and HIPAA. What is the stock law? The stock law, which is also known as the Ethics in Patient Referrals Act, was first enacted in 1989 by congressional sponsor Pete Stark. The reason for the law to be created was evidence that physicians abuse the system to gain personal financial gain by self-referring. Why is the stock law so important? The stock law protects patients from unnecessary procedures which were only ordered to financially benefit the physician. It is our duty to ensure that every physician that is associated with our facility follows the law by not referring patients to themselves, family members, or people they have a financial relationship with. If any employee encounters or suspects any violation of this law, the employee should immediately contact administration to investigate the situation. The stock law does not consider if the violation was intended or not. As important as the stock law, cultural competence is important as well. Diversity has a huge impact when it comes to healthcare facilities. When we speak of diversity, then we do not only consider race, but also nativity, language, gender, religion, age, disabilities, sexual orientation, etc. We have to consider diversity when we treat patients and also employees, since they all have different needs. By understanding the relevance of culture and other diversities, we can reduce disparities. In many areas, the statistical makeup of healthcare providers and administrators does not mirror patient populations, and this discordance is associated with poor patient satisfaction and health outcomes. Cultural differences in the clinical counter often result in misunderstanding and ineffective communication, which can have a negative effect on the healing process. To ensure cultural competence in our hospital, we will be distributing satisfaction surveys to our patients, which will be available in multiple languages and especially address culturally responsive services. As mentioned in the hospital's policy, we will continue to ask patients during admission if a translator is needed. To make the hospital cultural competent, management will perform a community needs assessment. Biannual team meetings will take place to encourage cultural sensitivity and also address the results of the community assessment. During these meetings, we will evaluate our cultural understandings, we will perform team-building exercises to learn from each other, and we will introduce our new e-learning program and the rewards for completing the training. HIPAA privacy rule. It is important to know the rules. As hopefully all of you know, HIPAA stands for Health Insurance Portability and Accountability Act, which includes the privacy rule. During this presentation, I would like to point out a few things to consider. Before employment, we all sign documents to protect the patient's privacy. It is essential for every single person working in this facility to understand the importance of the HIPAA Privacy Act. We need to know who we can give information to. If you are not 100% sure, contact your supervisor before giving out any information. If a violation occurs, the person or the facility can get fined. Please take a look at the civil penalties to get a better understanding of the consequences for violations. What do you need to know about the HIPAA privacy rule? A violation of the HIPAA privacy rule can happen in many ways. To avoid any violation, it is essential to consider the following points. Do not talk about patients in front of others. You might not think they're listening, but they are. Another point to consider is do not access patients' files that are not under your care. Even if you are bored and want to look through some files, you are not authorized to do so, and it will lead to an investigation. Every file accessed will be considered as a violation. It is also essential not to communicate with patients via private communication sources. In a time of social media like Facebook, patients are tempted to contact us to ask questions. A public domain is not a secure source and the information might be accessed from third parties. If contacted, please encourage the patient to contact the hospital with any questions. In addition, never ever post anything on social media that includes information that can be used to identify individual patients or their medical records. Another issue is that healthcare providers often leave the room and leave the computer unlocked. So it is important to lock the computer when you leave the room. The person left in the room can access not only his own medical records, but other records as well. Since you are logged in, it will be done under your name. If we receive inquiries over the phone, we have to ensure that the person is either the patient or an authorized person to receive any information. To make this process easier, we will soon be implementing a phone password for every patient. In conclusion, if you have any further questions, feel free to contact me. As we all know, in the healthcare field, an ounce of prevention is worth a pound of cure.